Hi, everybody. Welcome back to another episode of the ASAP Pathway podcast. I'm your host today, Dr. Stacy, and I have, of course, my partner in crime, Dr. Michelle Weddle, with me today. So it's fun when I can have one of the ASAP partners on with me. It's a rare and fun occasion because we're so busy. But I'm really honored and excited to bring to you our guest today, Dr. Jamison Spender. Thank you so much for being here today.
I'm thrilled. I'm honored.
We are
Round of
honored.
applause.
Yeah, we
Yes.
are. Yes. Um, really, ASAP Pathway would not be what it is or where we're at, or I don't even know if we'd be here, to
Would
be
not be
quite
here.
honest, if it wasn't for Jamison. So I'll go into that a little bit, how he made all these connections and all the connections he continues to make and the ripple effect of his knowledge and um, his passion for sleep and airway. But for those of you who do not know Dr. Spencer, this is not an exhaustive bio by any means. I'm just wanting to get to the meat of our podcast, but let me tell you a little bit about him. He's the director of the Centers for Sleep Apnea and TMJ in Boise, Idaho, and Salt Lake City, Utah. He has personally treated thousands of patients with sleep apnea and TMJ problems and now focuses on helping dentists help their patients with such problems. Dr. Spencer is the past president of the American Academy of Craniofacial Pain, a diplomate of the American Board of Craniofacial Pain, a diplomate of the American Board of Dental Sleep Medicine. He's an underachiever. Okay. A diplomate of the American Board of Craniofacial Dental Sleep Medicine and has a master's in craniofacial pain from Tufts University. He taught head and neck anatomy at Boise State University and is adjunct faculty at the University of Utah School of Dental Medicine. He has been invited to give lectures on TMD, dental sleep medicine, and head and neck anatomy throughout the United States at every major dental meeting, and has also spoken in Canada, Central and South America, the Caribbean, Australia, Europe, and India. He created the Spencer Study Club, an online education, mentoring, and implementation program to help dentists and their teams help more of their patients with sleep apnea and TMJ disorders. You can find the Spencer Study Club at spencerstudyclub.com. He also has a podcast, Airway Sleep and TMD podcast that you can check out for a lot of amazing free information and get to know him and his brilliance as well. Thank you for being here. I kind of wanted to go into how we all came to be, how we met. And Tracy and Michelle, Michelle, you and Tracy met through Jamison, correct?
So we met before, we knew each other before, but we did not speak together, Jamison. So Jamison put us together, and that was our first speaking event together. So we never actually thought to speak together. So that was amazing, Jamison.
Oh, very cool.
Yeah.
I'm not sure I knew that. That was in Baltimore, right?
Yes, you teamed us
Yeah,
up. Yeah. It was a
very cool.
myofunctional therapy presentation. And I think we underestimated the interest in myofunctional therapy. And when you first talked to me about it, it was 3 or 4 times, but small groups, and then it became bigger and bigger. And then as you were calling me, you're like, "Don't worry, I got you some help," because it was much more than we thought. Yeah, yeah. The interest was really huge. So
Right.
yeah, yeah. And then we spoke and it worked out really well. And then since then, obviously it's history.
Well, I got to know you through
Tracy.
Tracy, and I got to know Tracy through Kevin Boyd. Kevin Boyd said, "You have to meet Tracy." Kevin Boyd, I think, saw you guys potentially in some other meeting or whatever. It's just this whole Pandora's box of how we all met. But the reality of it is this. I've known of you, Jamison, forever because I've been an adult dental sleep medicine for over 20 years. And if you're in adult dental sleep medicine, everyone knows Jamison Spencer.
Mm.
So that's how I knew of you. And then we just were all kind of connecting and talking. And I don't even know how it happened, but I just remember one day, Jamison, you text me. You said, Stacy, I think the three of you, you're dynamic with how you meet and how you're talking and how you're trying to, educate and be more of a practitioner based platform and not, there's something to that. And I'm telling you, you guys need to do something. And I'm like, okay, thanks, Jameson. That's great. And then like a week, and then it's like a week later. No, Stacy, I'm serious. You need to do something. And we're so busy and we're all just hustling, bustling and everything. And then you're like, look, I'm trying to tell you, I would like to help you. I'd like to help catapult that for you. So I'm like, oh, okay. And then here we are. I mean, even the name, I think we were all brainstorming like the acronyms and
Yeah, that's right. The name came from Jamison.
yeah, the
So,
name came from
yeah.
Jameson too.
I remember
So
we were sitting in your living room.
yeah, that was fun. So we thank you for
Yeah.
having the foresight and the confidence and I guess trusting in us and trusting that what we had was important and what we had to say was important and you felt compelled to be part of to help push that out there. And if it wasn't for you, we wouldn't have done it. So I want to personally thank you for that.
Yeah, well, my pleasure. And yeah, the reason for that was the same reason I built Spencer Study Club. So there's, as you kind of mentioned there, Stacy, there's other programs, there's teaching I don't know if it's unfortunate, but just the reality in our field is there's a lot of industry focused stuff. People have a widget or a gadget or an oral appliance or whatever, and they're going to sell it. And they create programs for that, and they may get good doctors to teach for them, but still there's kind of this focus of here's this widget, and there wasn't anything in pediatric sleep yet that wasn't a little more skewed towards industry, or same thing in the adults is, I teach, as you mentioned there, I teach all over the world, but 99% of my teaching by invitation is beginner stuff. This is an apnea. This is what's going on. Here's some sleep hygiene stuff. It's all very beginner level stuff, and people can take what I teach and go out and help people immediately. I kind of pride myself on that. I want
Yes.
to give people
It's practical. You're like,
Super
get
exactly
in,
practical.
take it
practical
home.
knowledge.
Yes.
But
Yes.
then, and same thing in pedo, is like you could learn a little bit about myofunctional therapy, for example, and you could do a few things, but then pretty quick you're gonna hit the top of your knowledge and won't know how to help people. So I created Spencer Study Club so that people could go from that beginner, hey, I'm really excited about this, to actually implementation in pediatric sleep. There wasn't anything like that existed. I saw you guys. I know that you're doing it. I know you're passionate about it, and that there's a big need for that. And it's something that I don't do. So in our practice, like legit, I can count on a hand probably in 25 years the number of kids under 8 that we've seen. We'll see teenagers regularly, but nowadays a lot of teenagers are almost adults.
Yeah.
A teenager could be 220 pound,
Yeah.
whatever. So we see pediatric patients by definition of them being under 18 in our practices, but little kids, things like that, we don't. There's a lot of members of Spencer Study Club who are doing a lot of pediatric. They're general dentists. They're seeing these kiddos in their practices. A lot are doing tongue tie releases, things like that.
Yeah.
So I was more than thrilled to help you guys get started with that and to use my resources and what we learned. As we all go through these journeys, we make a lot of mistakes, and there's no sense in people reinventing the wheel when someone else has already been down that road.
Well,
It is
and
agreed. Because
agreed.
when we were talking about it, right? So I met Stacy through Tracy, and when you guys got introduced by Kevin forever and ever. You were on the phone for a long time. And when the three of us started talking, we were on the phone for a long time. But not just that, we were constantly on the phone weekly. We became on the phone. We started talking about our cases, and then it went on to clinical management and what worked, what didn't work. And then that was when Jamison, we were talking about it. I think it was in a Beast or one of the Spencer Study Club meetings, and we're just like, we need a mentorship. We need something like Spencer Study Club for pediatric stuff. And here we are. We were already talking, Tracy, Stacy, and I, and we're just like, we just need to make this something more formal. And we were trying to figure out. Remember, Stacy, we were trying to invite a lot of the experts in the field
Yes.
to try to say, can you start a club? Can you start a club? And then Jamison, when you started to say, well, here it is, like, you guys, the three of you could, and here's my help. Here's what I can contribute. Here's how I can get you guys started. That was just amazing. And it was not ever have started without you.
Yeah, well, again,
This
thank you.
ASAP
And again,
never.
the ripple effects, as Stacy said, I'm all about outcomes, and so
Mm.
it just makes me happy every time I think of how many kids have been helped because of you guys, and how many will continue to be helped, and that those kids will go on to do who knows what. You may have already helped the kid that without that diagnosis and treatment would not have created a cure for cancer. Like, legit, we're talking big deal stuff. So I couldn't be more happy to have had a role in that.
I okay. I was sorry. I thought you cut out there. Your screen froze for me. Sorry about that.
Uh-oh.
Nope. Yep. No, we're good. We're good. Um, Here's what is interesting about you, James, among many things, Jameson. You're very interesting, but here's one of the interesting things is when you got out of dental school, you just went like straight in to TMJ dysfunction, correct? Like you did not practice general dentistry out of dental school. Is that right?
Correct. Yeah. So I'm a general dentist. I was sort of offered the other day to get boarded in orofacial pain, and I'm like, no, thank you. So anyway, but who knows? I might still do that based on the guy who offered that to me. But anyway, so I'm from Boise, Idaho. I look to go back to Boise with my wife and kids, and in the process of looking for a place to practice there, we found I reached out to this doctor. I didn't know that he had this unique practice, but then found out about it. It's a longer story. Actually, if someone wants to hear the entire origin story, they can go to my podcast. That's episode 1, I think, is the origin story. But bottom line, I find this TMD practice and I take it over right out of school. My mentor was with me for about 6 months, and then the rest is history.
So, with that being said, obviously you're very passionate about TMJ health, sleep health. They overlap each other. It used to be viewed so differently. Gosh, when I got into adult sleep medicine 20 plus years ago, the whole thing was, well, you can make a sleep device for a patient as long as they don't have TMJ issues.
That's right.
And that is, I mean, and we still see some of that wording with insurance companies and things like that. So some of that old thought process is still hanging around. But the bottom line is the majority of people with sleep issues, they have TMJ issues.
Yeah, a
And
lot
they,
do. There's a lot of overlap, and yeah, funny you should say that, Stacy, because that's my experience too. And I don't know if you guys know this or not, but I helped create the program at Tufts,
yes.
the dental sleep medicine mini residency. I think that's like 14 years ago that we created that, and why we did that is I was at a Academy of Dental Sleep Medicine meeting, and for the 50th time, someone at the podium says, well, you can't treat anyone with a TMJ problem. And I don't know if you guys know this or not. If you've ever read the insert on any appliance that you use for sleep apnea, it will
Yeah.
say in there that it can't be used if they have a TMJ problem. That's from the FDA. Like, you have to put it in. including the appliance that I invented, that's in the FDA language is can't use it. And I'm like, this is total BS.
Yeah.
So I'm so mad. I leave the room, I walk out, I call my friend Nasher Mehta, who's the director of TMD at Tufts University. And hey Nasher, this is baloney. Like Nasher wasn't involved in sleep apnea at all at the time. Not a member of the academy or any of that stuff, like just completely not even interested in it. And I'm like, we need to create a residency in dental sleep medicine and connect it with TMD. And I am semi-famous for saying once that the first time I spoke at the Academy of Dental Sleep Medicine, I made the quip, dental sleep medicine is easy as long as you're an expert in TMD. And that did not win me a lot of friends, actually. There were a lot of people that were pretty upset about that, frankly. And it took them years to invite me back to speak again. Now, fast forward 15 years, 12, 15 years, they have programs in TMD. So, truth sometimes takes a while to kind of come out. But, now there's no one in the world that's like, oh, no, yeah, those things have nothing to do with each other.
Right. And we were just talking about this before we hit record too. Like, I mean, I just took my son, he's having some knee problems, and took him to an orthopedic surgeon. And I had taken my older son there like 6, 7 years ago. And so they wanted to inform me of all the newest things that are coming out. And they brought up PRF. And thanks to you and Michelle, I'm like, oh, I'm very familiar with PRF, but they said the miracles that we're seeing with PRF is amazing. And you're seeing more and more of that discussion emerging when it comes to joint health now, which, that includes TMJ health. And I know, Michelle, that you were talking earlier about incorporating that in our TMD courses, but Jamison, you two are teaching PRF in your courses too. But Michelle, tell us more about TMJ and PRF and the role of all that and the future of all of that.
Well, I learned PRF from Jamison, and I took the hands-on course. Frank Henrich and Kevin Mangelson, and it was great. And I tried to be very conscientious, if you know me, and every time I take a course and it's something completely new, it takes me a while to really incorporate. I want to understand everything. I'm that kind of person, right, Jameson? I want to take
I
all
think
the
a lot
courses
of
in the
dentists
world.
are like that. A lot of dentists are like that.
Well,
Absolutely.
and then there are some that can just jump right in. But I've taken Frank and twice,
Okay.
and then I took other courses, but hands down, Frank and Kevin's course, comprehensive and practical. And that's really what I admire and what I love about your courses, Jamison, is that it's super practical. You take it, you apply it. I learned TMJ injections from you. And the first time I learned TMJ injection from you, I learned it from a convention floor. We were just talking in some convention floor, and you're like, you don't know how to do TMJ injections? You're like, I'll talk you through it. I promise you can do it. And you'll do it next week. And so that weekend you taught me through this procedure. And Monday morning, my manager came in with a lockjaw. Monday morning. And I know that in Spencer Study Club, we have that video that you recorded. And here I was, she's like, I'm in agony. And I'm like, I got talked through this procedure. I haven't yet watched a video. So here I was watching the video, and she's like, just do it. And I unlocked her. Mm-hmm. She was in so much pain, and I unlocked her, and she was in great shape. Biggest proponent in my practice with anybody who was locked, right? But every time I go and talk to you, I learn something new, and it's super practical. So this TMJ PRF course, from Frank and Kevin, super practical, and they're having it again, right? And I think every time you put it on, it's sold out.
Yeah, pretty much. So we got Frank Henrich is the one to give credit for all of this. So Frank is a member of Spencer Study Club. He's a member of within Spencer Study Club, I have a a smaller group that we help with their practices called Business Elite. Michelle's a member of Business Elite. Frank is a member of that group. And Frank is a general dentist, and he does a lot of surgeries. He does implants, does a lot of full mouth reconstruction, does aesthetics. He does a lot of stuff. And he does it at a really high level. And he talked to me, this was years ago now, so probably, I don't know, circa 4 years ago, maybe. And he says, "Hey, I'm using this stuff for surgeries, and I think it might be able to be used in the jaw joint." And I'm like, "Okay, yeah, whatever." And I've been around a while, and there's usually nothing new under the sun. I've heard it all before. Every time somebody comes up with, "Hey, look at my new appliance I made," or whatever, I'm like, "Yeah, that was 30 years ago. It's already been done." And he told me about this book by this guy named Rick Myron. I've never heard of before. I buy the book, I read the book, and this is a fairly dense textbook. And I read it and I'm like, holy crap, this is unbelievable. So it's on regenerative medicine techniques in dentistry. And Rick is a periodontist. He's awesome, seek him out. And I learn a ton. And I think there's a few pages in this book that's this thick on using this in the jaw joint. And I was like, okay, this makes sense. Let's start doing it. So this is the way I tend to roll is I'll always try stuff first before I share it with my friends, and I'll share it with my friends first, and then I'll share it with everybody else after I get enough data. So this is how I do research. So I'm not at a university, I'm not doing double-blinded studies, I'm doing outcome-based, does this actually work? And so that's what we've done. So at this point now, Kevin Mangelson guaranteed has done more platelet-rich fibrin injections into the TMJ than anyone else on planet Earth. There's members of our study club that combined, we've done more cases than anybody, and we're just seeing positive outcome after positive outcome after positive outcome. And this has got me more excited than I've literally ever been in my career. Even the sleep apnea stuff was awesome, and the connection of those two things is also awesome, but the using PRF, and for your viewers that are less familiar with this, just in a nutshell, you take the patient's own blood out, spin it in a centrifuge, take the good stuff off, stick it back into them. And so very inexpensive. This could be used anywhere in the world to help people. And the way I'm teaching TMJ problems now, so I'm re-recording Spencer Study Club right now because we launched that the end of 2016, beginning of 2017. It's not that it's getting old. Anatomy doesn't change that much over the past, 7 years. But this is changing how I teach because a lot of the complexities of TMJ problems, frankly, go away if you can stick what the body needs in there, allow a healing process to occur. It becomes way less complicated to treat people. So I couldn't be more excited about this. I really hope. I was talking to a dude today that's a really big deal in orthopedic surgery and using these techniques in orthopedics. And he said that in his practice, he has found a 80% reduction in the need for surgeries that he used to do.
Wow.
I hope that within 5 years from now, and this is no offense to those who are doing these surgeries, but I hope that the people that have been known for doing joint replacement surgeries in TMJ, that they will have died off or retired, and that there will be no one to take their place because we will know that those things are not needed anymore. That's where we're headed.
Gosh, that's okay. So just talking about that, where we're headed. Well, let me back up just a second. There are people listening that, because we're jumping in about the connection between TMJ and sleep and how important that is. Can you summarize why you feel there is an overlap? Why is it that people that have sleep-related breathing disorders tend to have TMJ dysfunction or TMJ issues? Or what is that connection? Like, there is an overlap. Why is there an overlap?
Sure. So there's it's multifactorial for sure, but some of the things, and I've seen some people kind of attack some of these issues too, but that's because they tend to be reductionary and like all in as if. So one of the big connections is bruxism and clenching and grinding the teeth are often related to sleep apnea. Now, Dr. Gilles Levine is the world's expert in bruxism, and he's the one that found all this stuff. However, having said that, we all have patients that clench and grind their teeth, and it has nothing to do with their airway.
Right.
So we can't say, well, oh yeah, as I like to say when I lecture, man, I wish all bruxism was related to sleep apnea. Wouldn't that be awesome? We could blow air up someone's nose or stick a thing in their mouth and cure all bruxism. That'd be amazing. So it's not all, but some people it is. And if you miss that, then as I like to say when I lecture too, what does the brain care more about? Pretty front teeth, pretty veneers, or air? Well, probably air. So dentists have been missing this, and we've made it all about our materials science. And, God bless them, Glidewell creates Bruxer, a material that is impossible to break. You can't break it with a hammer. But that doesn't mean the patient won't try to still break it.
Right.
And where do those forces go? Again, I'm not being negative towards the biomaterials people that come up with these great things that are harder for our patient to break. But someone should be asking, well, why are they trying to break it in the first place? So that's one thing is so in our practice, we don't do a night guard without ruling out sleep apnea. We don't do a night guard without ruling out sleep apnea. Now, what else? Okay, let's say have sleep disorder breathing. Maybe it's relatively mild. In a lot of younger, fitter women, they will have what is sometimes referred to as upper airway resistance syndrome. It's not quite sleep apnea. It doesn't meet the definition. And the definition of sleep apnea is stupid anyway. So
Yeah.
again, people can go to my
They can't even agree on
podcast and
right.
listen more about that. And the sleep doctors are agreeing to that too.
Exactly.
Nowadays. Why do you have to stop breathing for 10 seconds? Why is it 9 seconds? 9 seconds doesn't count, 10 seconds count. Anyway, it's all stupid. So bottom line, women like you that are younger and fitter and not obese and
Wait, can you say that again? Women
women
like
like
me
you
that are
younger
what?
and
Oh.
fitter. You know that.
Okay, go ahead.
And
I'm sorry.
so you're going to have disrupted sleep, but you wouldn't meet the criteria of the fat old man who has sleep apnea. And your degraded sleep, we all know that degraded sleep is going to make you more likely to have pain, more likely to suffer with that pain. So that also correlates. It doesn't have to have anything to do with the clenching teeth. It can have to do with just the overall reduction of your ability to handle these pain problems. So that is a big thing. Then we get into people with internal derangements and muscle pain and stuff like that. And dentists start treating them with appliances. And Gilles Levine, this will be the 10-year anniversary of his study back in 2014 this year that showed use of a flat plane night guard can make sleep apnea worse. So how many people out there, today are going to fit a night guard and that patient's actually going to get worse? So there are just so many interrelated aspects between sleep and TMD. And again, it's not all or nothing. It's a little more nuanced, but bottom line, if a person's jaw problem is related to an airway issue and you ignore the airway issue, their jaw problem will not get better.
100%. Actually, on the topic of Gilles Levine, I just saw him speak at Transform Dental Sleep in Scottsdale in February, and he was showing basically a mandibular advancement device versus a maxillary occlusal splint. The research was interesting that the advancement device, regardless of apnea, what have you, actually helped decrease the clenching and the grinding more so than an occlusal splint ever would. So people really just need to understand, this whole topic so much better, because let's say you're like, I don't want to do the airway stuff in my practice. Okay, but you still need to understand it, be able to identify it. I mean, the American Dental Association has said that is now a guideline that they really recommend, oral cancer screening, airway screening, sleep screening, adults and kids. But you also need to understand just even your options with controlling and helping bruxism and clenching and the root causes of that. I mean, good grief, we're dentists. We have to really understand this.
That's
It's
right.
not, you can't punt everything off to somebody else. You really kind of need to understand this better in your practice. I was going to ask you when we were talking about the future of back to the joints again
Yeah.
and sleep health. You know, you said I really believe the future of, I mean, right now we do need our sleep surgeons, our oral surgeons, and I do refer for some TMJ. Um, I have referred for joint replacement. I've had some rheumatoid arthritis patients with nothing, and there's a place for it. But wow, I was hoping you could pull up actually a slide on
Sure.
one of your in one of your classes. I guess is this one of your students or the
Well,
Spencer Study Club member? Or
yeah, I guess I would call her a student, and she would probably take that characterization. So let me pull that up. Sorry here.
yeah, because I mean, I just the
There we go.
future of sleep medicine is changing. Collaboration's going to be changing. And when I saw this slide earlier, I'm like, whoa, this is impressive. So
Now
those
Can you
of
see that
you,
okay?
we can
yeah,
understand where you're coming from when you say a lot of the surgery can
So
be.
this is my friend Dr. Tanya Kushner. Uh, I've worked with her for a long time. Her background, she was a general dentist in Chicago. Actually, she was a student kind of early on of mine. When she started getting interested in TMD, she ended up moving to Seattle to take over a TMD practice, and she's just gone gangbusters, has one of the largest TMD and dental sleep medicine practices in the world at this point. She's just an amazing practitioner. And to her credit, as well, I'm a big believer, and I think I recorded a podcast on this a while back. There's a big difference between 20 years of experience and 1 year of experience repeated 19 times. And there's a lot of dentists out there, they take a course or something like that, and like that's their dogma forever, right? And I am more impressed by someone I might meet who says, oh, you know what? I'm doing something different now. I
yeah,
found something with better outcomes. We're not doing that anymore like we used to, than I am with someone's like, you know what? I've been doing this the same way for 30 years. Uh, okay, so we're not doing things the same way that we were 3 years ago in our practices. And this is a big part of that. So what we're looking at here on the screen, this is a coronal view of the TMJ. This first panel here, this was a patient that came in to see Dr. Kushner, typical TMJ complaints, pain, dysfunction, stuff like that. She did some basically traditional splint therapy, some physical therapy modalities, just kind of some of the basic stuff that we would always do. The patient felt better, had better function, was doing better. And then after a while of doing better, she started to have pain again. This is not terribly uncommon, but when that happens, then we kind of jump back into diagnosis mode. What's going on? Why were you doing better? And now you're doing worse. So Dr. Kushner takes another cone beam CT and sees this massive degeneration of the condylar head. This is the type of patient, I guarantee you, that had this person seen an oral surgeon who would do joint replacement, this would have been someone referred for joint replacement. Guaranteed, 100%. Okay. Well, Tanya puts the patient back into active splint therapy and adds platelet-rich fibrin injections. 3 platelet-rich fibrin injections over a period of about 3 months, and then some healing period. And then here's our last in that series. And what blows your mind here, you see this little white line across here. That's the cortical plate coming
yes,
back that was broken down here originally. So we have a massive breakdown of the condyle that was going on. This had nothing to do with that original splint therapy. She just happened to catch this in the process of breaking down. And as we all know, x-rays are a little bit behind, so to speak. There's a active process going on, and we're not necessarily seeing how bad it really is because that active process is continuing. The patient felt better because of the treatments, but still had that breakdown historically. And historically, I mean 3 years ago. Okay, so I'm not talking like in the 80s or something. I'm talking a couple years ago, this person ends up with a massive surgical procedure, more likely. Or we just like, hey, yeah, sorry, your jaw's breaking down like crazy. Not much we can do about it. Nowadays, so something I kind of like to say is historically, we've tried to help our TMJ patients get worse as slow as possible.
Yes, right.
Now we are reversing their problems. Not always, not in every case, but dang near every case.
I mean,
So
and that
again,
was
this is why I'm so
unheard of.
excited.
That was unheard of years ago. Unheard of. Which is why so many dentists, I think, have avoided this mysterious, scary, it's intimidating because you're
100%.
like, we can't do anything about it. And,
Yeah. And
the
something I'm really
as
excited about
dentists,
too, something is, we have a Spencer Study Club live event in the fall, and I'm really excited that we have a speaker coming that's an orthopedic surgeon.
yes.
And this, I don't know about you two, but I'm an evangelist for PRF, PRP, regenerative medicine. I can't go anywhere, like anywhere, without talking about this. I go to church and I see someone hobbling a little bit. Hey, what's going on? Oh yeah, my knee's bothering me, and yeah, I'm gonna have to go in and have a steroid injection. I wouldn't if I were you. And I'm talking to them about PRF, and I'm referring them over. And I've got a little back thing myself, a little facet joint problem that I will flare up every once in a while. I've had consultations for regenerative medicine. This Dr. Talik is his name in Houston that I'll be bringing in for my course. I'm probably going to go to him because, like Kevin Mangelson for TMJ now, Dr. Talik is the world's expert in treating these previously surgical cases non-surgically. If you got any of your viewers that are over 40, they probably got their own aches and pains right now.
Yeah, I'm sitting here thinking I might go make me a visit myself.
Hey, historically, dentists are all
Yes.
about the shoulder surgeries and the neck surgeries and the
Yes.
fusions and all this kind of stuff. I really think we're headed to a world where that is extremely rare. Thank goodness.
Thank God. I mean, truly. I mean,
game changer.
it is a game changer. So, where are you seeing? Okay. I mean, everything's changing at lightning speed. And this is why I'm so appreciative that I have people like you, Jamison, and Michelle, and Tracy, and all our ASAP members and Spencer Study Club members. Like, we are all learning from each other and discussing what's going on in our practices, anecdotally what's happening, because the research isn't on track yet. It's going to eventually be. But if you wait for the complete research to lay out before you make a move, before you decide to dive in and learn anything, you're going to be 10 years behind. So it's like, it's changing so fast. I've
So,
noticed a lot of, you've got medical doctors coming in and speaking, sleep physicians, orthopedic surgeons. This is what I'm hearing. This is what we're doing in ASAP too. The medical dental collaboration, I think in the next 5 years is going to be nuts. So you're going to have medical doctors. Hey, dentist, heads up. You're going to have MDs coming to you about sleep, about airway, about craniofacial development, about TMJ. Don't you feel that way?
oh yeah, and I'm so glad you brought that up, Stacy, because it's one of my pet peeves. I just got a marketing piece from some guy in our field yesterday, and it was all about evidence-based this, and I was like, you don't mean evidence-based, you mean research-based.
There you go.
And when people are research-based, it's to make them feel good. It's to make them feel smart. Look at these studies, look at all this stuff, look at this as you just commented, usually the research is a decade behind, and we have the research come out. We're like, oh yeah, that's what I've been doing. So our research, as I mentioned, is outcomes, what is happening. Now we're surgeons, okay? Like, I don't know if you guys have DDS degrees or if you're cool like me with a DMD degree, but if you got that DDS degree, it's Doctor of Dental Surgery, right?
Yes, yes.
That's what we are. Okay, what do surgeons do? Surgeons do a double-blinded placebo-controlled trial where they just like they cut open one person and then the other person they pretend to cut open. Sort of. Sometimes they will do sham surgeries and stuff like that, but not for the most part. Usually what surgeons do is they do a technique. The surgeon goes, you know, I think I can do this better. And they do something and it works. And then they like do it again. And then they tell their buddy. And then they do several of their buddies because all physicians are always together, right? They're always in groups and stuff. So they're doing this collaboration that we're doing here and that you do in ASAP and that I do in Spencer Study Club all the time. As dentists, we're islands. We get out of school and most dentists are by themselves. They're not collaborating with their assistant or whatever. You know, they got to go to Gordon Christensen once a year to hear what the crap's working.
Right.
And thank goodness we have people like him that'll do the practical research of, hey, this composite's good, this one sucks. Hey, this scanner's good, this one's not so good. Because we wouldn't know otherwise, except when we share. If PRF would have been a failure, so let me give you an example. 20 years ago, we were in the Academy of Craniofacial Pain. We got excited about, oh shoot, I just blanked on the name. Help me out here.
Was it the injection in the joint?
Prolotherapy.
Oh, prolotherapy.
Prolotherapy. So proliferative therapy. And this involved injecting basically sugar water into the joints, tendons, muscles, things like that. And sometimes there are irritants involved and things like that, but prolotherapy. And we were super excited about it. And same thing, we'd go to these courses, we'd have MDs coming in who are using it and all sorts of cool stuff. And we went back to our practices and started using it. And within a year or two, we stopped because all of us had the same experience. If you did this in a 16-year-old, yeah, it worked like gangbusters. You did it in a 30-year-old, non-smoker, otherwise healthy, didn't seem to help at all. And it's like, why are we doing this basically by definition invasive procedure if it's not helping? And all of us stopped. So that is real life what we do. So the evidence-based, if people will go back and Google the diagram, the Venn diagram of evidence-based medicine, it's a circle for research, a circle for the clinician's experience, and a circle for the patient's desires. Evidence-based medicine is in the middle. We're not talking research-based. Yes, we will look at the research to help us understand. Like, for example, there was there's things that come out with basic science of how tissues are responding, or Rick Myron, who's the dentist most known in PRF, has published over 300 articles. And a lot of them are, how do the cells react in a petri dish? And then how do they react here? And how do they react in an animal model? That's all really awesome research to help us understand the what is happening. Frankly, though, from a practical dude, I don't know that I care. And you know, in the physician's desk reference, you know what the most common phrase in the physician's desk reference is? Exact mechanism of action not completely understood. We don't know how 90% of medicines work. We just know we give them this thing happens. We have a theory. Did you guys know? Go back to your Malamed textbooks. There's 3 theories on how local anesthesia works. In your Malamed textbook from dental school, you learned the 3 theories on how anesthetic works.
And
so don't give me this bull crap of like how cool you are.
Every day.
You got a bunch
Every
of stuff.
day.
Anyway.
Well, I think this is a call to action for dentists to look. You have to expand your education beyond what we learned in dental school. And I will say some dental schools, some like University of Pacific orthodontic program, thanks to Audrey Yoon, she's incorporating sleep in the orthodontic residencies.
Totally.
Like, things are changing, okay, but not fast enough. So you dentists, orthodontists, pediatric dentists, oral surgeons, you're going to have to step out of this paradigm and start, you know, expanding your knowledge base and looking into uh, what is happening in the world of sleep and airway and TMJ dysfunction, and just get some education. Like I said, if you don't want to do it yourself, you have to screen for it. You have to at least screen and start having conversations in your community, because I promise you there are doctors that are doing this and want to do this.
And at
But you
least understand
and just
what is
understand,
possible, right? What's
yes,
out there, what
what's possible, what's out
have a
there.
patient in front of you or a physician asking you about it, you can speak to it.
So I wanted to kind of wrap up. I know everybody's busy, and we'll have to have you back and talk more, because there's so much to say, and I feel like we didn't even get to most of what I wanted to talk about. But um, people can reach out to you through spencerstudyclub.com to, if they want to learn more about the adult aspect. It's a very similar platform to ASAP, which is this, but for, pediatrics. You can like do this stuff at home in your pajamas and learn. Of course, you have live courses coming up too, for adults, and a lot of hands-on. And what I love about you, Jamison, is you're a meat and potato guy. Like, we want you, it's 8 o'clock. We're starting. Let's learn. You're going to go home Monday, and you've got a community to help you along the way as well.
You're going to help your patient. Day I walked in and helped my manager unlock her.
Yes. Day one. So that's what I just love about it. It's not, you're very hands-on, and people are going to come out.
And the PRF, because
yeah.
that's the biggest game changer. They can learn about it at Spencer's Study Club. They have to be members, yes,
Right,
to
right.
be
So
able to
we
come.
only do, you just mentioned it, Stacy. We only have our hands-on live courses are for our members, because we can then just get rocking. We never have we kind of make people review the anatomy videos and the basic videos, so that when Michelle's been to the course, she walked in and literally it started and bang, we go. There's no futzing around. And comment too, just to kind of wrap up, if you don't mind me bringing something up that I know that you guys are passionate about too, is for your listeners or anybody who finds this podcast and stuff like that. As Stacy said, go out, seek out the education, but also do a little research on who you're going to learn from.
Yeah.
One of the things in this dental sleep medicine TMD field is there's a lot of charlatans, there's a lot of scumbags, and there's a lot of people who are posers that have never really done this profitably in their practice. They've they talk a good game, but they're not really doing it. And as Michelle knows from being in our business league group, we open up our books. We're very transparent with everything that we do. Spencer Study Club is very affordable. Just this last week, I had someone contact me about someone, and they were going to spend $180,000 to learn the secret sauce from some guy that's lost his license. And this guy who's lost his license is gonna charge this other dude $180,000 to teach him the secret sauce about dental sleep medicine. This is a very small field. I know where all the skeletons are buried.
Yeah.
Michelle's been around a long time too. Stacy, you've been doing this a long time. Tracy knows people. So any of you watching this, if you are wondering, just ask.
Just
Just
ask.
reach out. Hey, what about this person? What about that person? We'll tell you. We'll give you the
Absolutely.
straight scoop on that. And I have so many recovering people in Spencer Study Club who spent tens of thousands, if not hundreds of thousands of dollars, literally
Yes.
on easy buttons.
There
And
is
now
no easy button.
there's no easy
Gotta
Anybody,
do the work.
you have to do the work. And here is if you have a company that comes to you for dental sleep medicine, because they've come to me over the past, and I know quite a few people that have had loans to take these courses. Okay.
right.
And there's lawsuits out the yin, and then they reinvent themselves. They name themselves something different 4 years later, and then they reemerge. And I'm like, it's the same guy,
The same
new
people.
name. Like, what's going on here? But the reality is this: you have to do the work in your community. You're going to have to make some phone calls. You're going to have to earn the trust of your colleagues, because what they're selling you is a package of, hey, give us tens of thousands, hundreds of thousands, whatever. And, you know, we're just going to have this doctor refer everything to you. You won't have to do anything. Run as
Right.
fast as you can.
Run away.
By the
Run.
way.
It's not how life works. People still, and thank God for this. This collaboration is working on trust and building relationships between
That's right.
practitioners. Thank God for that. Thank
That's
God
right.
for that. I know
And
we're going to wrap.
results in helping
Yeah.
patients.
Yes. And if
Right?
people want to learn more, again, Spencer Study Club, definitely for the adult TMD sleep and then pediatric TMD and sleep. We both will have PRF training with both, one's through ASAP Pathway and one's through Spencer Study Club. Before we go, though, I want to ask my little favorite questions I like to ask of our guests. What was your favorite game to play when you were a kid? Your favorite game?
Like board game or something like
Any
that?
game, like it could have been Twister, it could have been outside game, it could have been some, yeah. We didn't have video games, did we, Jameson?
No. Yeah, exactly. Pong. Yeah, no,
Yeah,
it
Pong,
was not
yes,
Pong.
Pong.
So I would say probably a game called Rook that we played as a family.
Yes, I
So as a
remember
family,
Rook. I
yeah,
remember
Rook.
that.
Yeah, and we still play it. Still play it to this day with my kids.
I love that. I miss that family game nights, you know? Gotta bring them
That's right.
back and keep them going. What is your favorite dessert of all time?
Favorite dessert? I love a good creme brulee. And when you asked me that question, it just popped in my head. We were in Hawaii, and there's this place, I think it's in Kihei, if I remember, and it was brulee served in a pineapple. It was a pineapple creme brulee served in a hollowed out pineapple. That was amazing.
Oh, that
I
is
love
like
desserts. And now, oh my gosh, that sounds
Okay,
amazing.
Michelle, what's your favorite dessert other
What
than the banana barge
do you
from
mean ice
uh,
cream? Like any
you love
whatever
anything?
ice cream you're yeah. My banana body from Carvel.
Yeah, that's her favorite. She'll when she's stressed out, she'll text, "I'm heading to get a banana barge." I'm like, "It's been a rough day, hasn't it?"
Nice.
The last question I have, what is your favorite thing to do? One of your favorite things to do on a day off? Like you've got the whole day ahead. What are you going to do?
Boy, that's a tough one. So because I can't give you the entire quote, but my work and my play are indistinguishable at this point. So I'm always working and I'm always playing. My lifestyle is rather wonderful. I get to help
Ah,
people like you guys and stuff like that. So I would say my favorite things are I love teaching dentists and seeing them go out and help their patients. However, having said that, I have a bajillion hobbies too. So
you
I'll go
sure
out on a
do.
mountain bike ride today. I've gotten into kiteboarding because of my friend Noah Siegel, who some people might know, who's in our field. He's an ear, nose, and throat sleep doctor. So now my youngest son and I kiteboard, and we've been all over the world kiteboarding at this point. I ski. So yeah, I have, as my wife will tell you, I have no shortage of hobbies. That's not one of my problems.
Well, we appreciate you, Jameson, and we appreciate you. And hey, Jenny, we appreciate you sharing Jameson
Yeah,
Oh,
for
with
sure.
us. I know she has to do a lot of sharing, and we love Jenny, your wife, and appreciate her and your whole family.
Thank
Um,
you.
Team
thanks for
Spencer.
being here. Yeah, thanks for being here, and we'll have to have you back soon.
All right.
All right, guys. Thanks, everybody. Have a great day.
Take care.